Pregnant females they appreciate any relief that you can give them.
Did you say cranky?
No.
Cranky? No, you said cranky.
Well,
It's the same thing. It's the same thing. They're synonymous. Same thing.
So we've had a couple experienced folks in here. Please chime in if there's something in here that you experienced for everyone's benefit. We know that there's a lot of endocrine changes that go on. We've talked about these already. The increase in progesterone and estrogen will increase fluid. So my wife was pregnant when I first, he came in the beginning of October, so she was pregnant all through summer. And she was a miserable soul. I mean, I remember her going to board meetings and stuff in flip-flops because she couldn't put her feet in any shoes that she had. So it was bad. So lots of fluid restriction or retention. Relaxin, we've talked about this, how it will increase ligamentous laxity. This is a big one. If you guys are doing a bunch of manual therapy, you have to consider this. I will never forget this lovely lady. She was great. Came to me for about 5 different things. She's pregnant for their first child, and she's like at all the sciatica. I mean, she can't walk down the street. And I remember pulling on her leg, and it just felt like it just kept going. And I'm like, oh, that's crazy. Well, I had another one who was a runner. She ran until her 8.5 months. I mean, it was crazy. She had all this back pain. So I was just doing a quick assessment of her, and it was like her spine was just nothing. There was nothing there. It was just like I could just push all day. Insane. She actually had such laxity that she would dislocate her patella, like getting out of the car and stuff like that. It was amazing that she got through what she got through. Then she went right back to running, of course. So obviously, was heat production increased as well? Absolutely, pump it up big time. It's always fun. Breathing difficulties. There's hypersecretion due to the hormonal changes, and even changes in the rib and diaphragm position. Everything's got to go upward. So when it goes upward, it goes out. And it doesn't always come back right either. So keep those things in mind. Yeah, yes.
So because it doesn't come back, do you have to do rib manips at all? Or
Rib mobilizations are the easiest ones in the world. That's when you just lay somebody on the side, you push it, it's like a bucket handle. If you push the top of the bucket handle, everything moves on the outside. But, you know, I would say that I would see that more or less with pregnant females.
I had to have some of them done when I was pregnant with my first one because she was so far up and running out of room that she would just like pop right through that rib, and they were afraid she kept getting stuck. So they just like
Guys, you just be thankful. Be very supportive. Tremendous cardiovascular changes. A 35 to 50% increase in blood volume. That is a lot. That's a lot. So therefore, our cardiac output also has to increase as well to pump this blood. I say we. I didn't do it. Many are anemic. Gotta get the right nutrients going. How were you guys with eating? Did you change your eating habits?
I just wanted a lot of milk.
You wanted milk? Yeah, that was your craving?
I was wanting milk.
Interesting. That's a good one.
Yeah.
And now that's all my kid drinks.
The first one I definitely changed more than the second time around. Second time I'm just like, I'm gonna eat what I want to eat at this point.
So my wife, we were big on the nutrition thing at the time. So I would make her a smoothie, one of those big 32-ounce cups. It had all kinds of stuff in it, fruit, protein powder, a we counted it up. It was about 1,200 calories every morning. She would drink that as soon as she got up. Well, what she wasn't telling me is on her way to work, she was also going through McDonald's drive-thru and getting McGriddles. That was her go-to. So I will never forget, we go for like the maybe 6 month checkup. And you guys have met my wife, she's long and lean and all this. She had gained, I think it was 52 pounds through like 6 or 7 months. And the doctor like stands up and he goes, "This has to stop." And I thought she was gonna kill him, literally. So we tailed off on the, once I found out about the McGriddles, I tailed off on the smoothies as well. But that didn't help the swelling in the legs either. Yeah, that was quite a time. But again, big pressure on inferior vena cava. You've heard this before, I would think. Laying supine in third trimester, not a good thing. That's gonna put a bunch of pressure due to the fetus moving upward because it can't go much more, is gonna press on that. So what you can do to counteract that is, number one, don't lay them in supine, put them in sideline. But if you have to put them in supine, you need to put something under the right pelvic region. I think it's that low. Did y'all ever do that? Yeah. And that will take some of the pressure off. But it's just best not to put them in supine, just put them in sideline. You can do pretty much everything you need to do there. But no, look at heart rate. You wonder why they're tired. Their heart rate's going crazy too. So, carrying around an extra person. Amazing. Y'all are ready, aren't you? Weight gain.
Doctor looking better and better the more we go through these lectures.
25 to 30 pounds on average. Okay? So, again, I think Michelle topped off at 54 pounds. She was not happy afterward. I think she only gained 25 for the second one. But I had a front office person who worked for me, and she was on the bigger side. She lost weight during her pregnancy. She couldn't eat anything. She threw up everything and just couldn't eat. She actually lost weight, which the doctors were concerned about. Obviously, we've got stress to the abdominal muscles. I got some good pictures of that. Rectus abdominis and linea alba. Remember what linea alba is? Do you remember this? The line that goes right through here before you six pack. That will get stretched to the point. Sometimes it does, sometimes it fails. And again, highly stretched muscles are not strong muscles. Okay? So we got to keep that in mind. We're not asking their abdominals to do a whole lot, hopefully. Pelvic floor muscles have a great deal of weight that's pushing down on them. And again, please tell me, Rachel, we'll do this via Zoom.
I think so.
Think so? Our best guest speaker in this whole curriculum is pelvic health. And she is incredible. I mean, so good. And hopefully she'll do this via Zoom in the fall. Much, much better than I will do. Tremendous ligamentous laxity we talked about. But we've got very loose joints here. Do y'all have any subluxes, anything? Nothing? Oh, lucky you. But it can be an issue for sure. So here are the musculoskeletal impairments. I think I've probably seen all of these in the clinic. Center gravity is altered, obviously moving forward. So you're gonna see this increased lordosis, which is gonna compress things back here. With the extra weight, the extra pull, you can get pressure. The hypermobility will increase junior recurvatum and or pronation. So you guys that flatten out, you're gonna flatten out. So your feet are gonna hurt more. Yeah. Everything's gonna hurt a little bit more there, okay? Balance is a problem, as we can obviously tell. We've got a different base of support. The hips will externally rotate a little bit more just because the pelvis just needs more room. So you're gonna externally rotate. And ADLs become progressively challenging. Yeah.
Just don't even try to tie your own shoes.
Tying shoes, I
Have
was
your
gonna
other
say.
person, have somebody else do it for you.
Tying shoes, you just get into the slip-in variety, right? Getting up from a supine position, not easy.
Getting in a car, like a turtle on its back.
Turning over,
Like a turtle on its back.
a turtle on its back. Yeah, but I tell you what, again, a very appreciative population. If you can give them any relief, they will be incredibly thankful. Subsequently, much of this stress leads to pelvic floor dysfunction. All the way from just strains and strain to prolapse, which can be dangerous and need surgical intervention. Urinary or fecal incontinence, lots of fun there. But pelvic floor strengthening is not just for females, guys. There's a good friend of mine who was having a bunch of pelvic floor or just having pelvic pain during running, and went to see Rachel for one visit. She put him on a home exercise program, and his pain running went away. So that's not a coincidence. There is a lot of hypertonus, muscle guarding, and spasm in these pelvic floor musculature. You gotta have the right balance and strength and all this type of thing. She will talk to you a great deal about that. And there are specialists that's all they do, is pelvic floor health. Diastasis recti, here we go. Midline separation. But not just in pregnancy. If you see the old men with the big Budweiser tumor in front, they can get this, okay? Now, here is the test. You put them in hook lying, so supine, knees up, feet flat, and they will raise their head and shoulders off the mat. So just the beginning of a crunch. And you will take your fingers and put them here above the umbilicus, at the umbilicus, and below the umbilicus, okay? Positive test if the fingers slip into the gap or there is a visual bulge. And you grade it by how many fingers you can slip in there, okay? I have seen grade 4. And I also saw the same person with grade 4, I think it was like 16 months later, no visible sign. She was teeny tiny, had 2 babies, gave birth, started training and doing the things we're going to talk about here, and this, I don't say it resolved itself because she did a lot of the work, but she got much, much, much better. But this is what it looks like, okay? Here's our muscle head who's done so much work that his is stretched out. Here's the old man with this distinct bulge here. And this is how you self-test this, okay? So if you get a referral for this, or you have somebody that has this, you're gonna support this. It's like bracing. So you're gonna wrap this around for proprioceptive support, and you'll progress until that separation is less than 2 centimeters. You're gonna avoid Valsalva. You're gonna do pelvic floor education training, pelvic tilts, very slowly progressing abdominal progression. I remember we walked this lady through this whole thing. She was just amazingly compliant, probably too compliant, and this resolved with her. She did great.
Can this like come back?
Yeah. Yep. And you can imagine if you've had something like this, how much weaker it is. So if you go have another baby, it's probably gonna be worse. So, things to think about. Things to think about. Some complications to exercise. You've got to have their OBGYN on board. That's a must. Most OBGYNs that I know of will tell them you are fine to exercise as much or as little as, or probably as much as you want, just as long as you've done that prior to pregnancy. So if you're a runner, you can keep running. If you played tennis before, you can play tennis while you're pregnant, okay? They just don't want them starting up something new. Hey, I'm gaining all this baby weight, I'm gonna go start running. That makes no sense, no sense. Because the hormonal thing is gradual too. Your body doesn't accommodate to this. It gets used to it. Contraindications. These are all OBGYN types of things. Confident cervix. The preview is where it actually comes apart from the symptomated detached from the uterus. Yeah, that's what I thought about that. Just come up with that. Preeclampsia is a elevated, very dangerous elevated blood pressure that occurs a lot of times later in pregnancy. Usually we'll get put on bed rest if that's the case. Okay, so you're not going to be seeing that. Risk of premature labor. We don't want anybody having babies at the clinic, so because they're going to exercise, let them do that on their own. And maternal type 1 diabetes mellitus, as opposed to gestational diabetes, which is different. I don't know the whole specifics on that, but if you see these things, these are absolute contraindications. Here are some precautions. We said gestational diabetes. Did y'all have that test? Where you gotta go drink the nasty orange stuff, and it's awful, isn't it? Yeah. My sister threw hers up and she had to go do it again. So yeah, it was bad. If you are anemic or very, very fatigued, please keep all this in mind. Don't eat Peeps.
I was just looking. I wasn't opening
What kind of musculoskeletal complaints did you have? Any? Does your back hurt?
Yeah.
Yep.
My knees hurt.
Knees hurt?
My feet hurt.
Okay.
Sometimes my neck would just hurt. Just trying. I don't know. And I was still working at the time, so I was sitting up.
Probably
a
due
lot.
to posture changes, I would guess. Miss Brittany? No?
I had a very easy pregnancy.
You were good. Awesome. Ready to have another?
Yeah, it's not.
And obviously we talked about that diastasis. If that's present, you're gonna have to be very mindful of what you can do and what you can't do with them.
With exercise during pregnancy, you know how he said about tennis, like gave that example. Some things that you need to educate them on is that their center of gravity is going to be shifted. So they're going to be more prone to fall forward because belly is forward. So they need to be careful as far as even going downstairs and doing the agility stuff. Those are things that they need to be aware of, which then goes into the musculoskeletal things with the agility stuff.
Stretch with caution due to the hypermobility that's present. Overstretching hamstring and adductors increase pelvic instability. I've never seen that, but that comes from the literature. We talked about the vena cava compression. Avoiding Valsalva, that just kind of makes sense as well. Avoiding heat, encouraging fluids, certainly. Avoid single leg stance. Why?
Center of gravity, laxity.
The belly side.
Their leg's gonna buckle.
I've seen this one 3 or 4 times. We talked about the SI joint and how it fits in here very snugly, it's super tight, lots of ligaments. But when that relaxant hits, this gets obviously the pelvis has got to get a lot wider for childbirth to occur. So you talk about last trimester types of things. Simple as going up and down the stairs, and they will sublux or suffer an SI sprain, and it is exceptionally painful, okay? So keep them in mind there. Is don't let them do a lot of single leg stance because it's gonna put stresses on this, right? Keep both feet on the floor. That's why impact is problematic. Common interventions in terms of therapeutic exercise, posture training, like Ms. Ann was talking about. Let them understand that their body is changing and what we can do to counteract that. Is it advisable to make sure we've got some lumbar support because we got more lordosis? Absolutely, okay? The, I can't remember what it's called. It's like a belly sling type of thing. Yeah, that can be helpful as well. Just gives it a little bit of support.
Belly band? Is that what they call it?
But Miss Rachel will counteract that by saying that makes you not use your abdominal muscles. So
It's like any other brace.
it's like a Band-Aid
Yep.
essentially.
Yep. Talking about pelvic motion and pelvic awareness and doing tilts and clocks and things like that. Those are really hallmark exercises there. Quadruped exercises to enhance pelvic stability, really, really good. Curls and crunches, be careful. You saw how that made the diastasis increase. Again, low impact is definitely the safest thing to go, but just use the pre-pregnancy time. I mean, I've known pregnant ladies that went skiing and things like that. That seems crazy, but you do what you do, right? Kegels, we talk a lot about that. Giving feedback through mirrors and manual stuff, and even there's what are the things that the internal,
Like the probes
that they give off the pressure and all that kind of stuff. She
Biofeedback.
talks about all that stuff. Biofeedback, that's what I was trying to get. Thank you. Elevator exercise, again, it's all pelvic floor stuff. Talking about pain, there are definitely things that you can do, modalities wise, soft tissue wise, positioning wise. How many pillows do you have in the bed?
Oh, I have probably 4 or 5.
I told my wife, it's like, any more pillows and I'm gone. She goes, that's the whole idea.
I've got like massages left and right.
Yes. All that's great. All that's great. Our massage therapist that we had at our clinic, she saw so many pregnant females, she had a table with a cutout. So, worked good. But again, talking about positioning, it's not just common sense, okay? They need some help with this. Body mechanics, heat massage, deep breathing, we talked about the relaxation stuff. All that can come from us, okay? And if you enjoy working with this population, you can carve yourself a niche even as a PTA. Rachel was looking for PTAs to work with her, wasn't she? This is an in-demand specialization. If you enjoy working with it, get after it. Because you can make a great living and work with the people you want to work with, okay?
There's a lot of OBs now that are actually will prescribe this after you give birth, but there is still a lot out there that still have no idea what this is. So a lot of just education needs to be put out
Yep.
there.
I look forward. I'm certainly hopeful Rachel will speak with us. All right. So your case assignment is right here. You are going to develop an exercise program for Julie at 4 months. Julie is active. She is, let's call it 26 years old. She's in relatively good shape. She has a desk job, but she enjoys walking, playing tennis occasion. that type of thing. This is her first pregnancy. And you're going to devise an exercise program, and patient education should be part of that too. Let's just say therapeutic procedures intervention for her. At 4 months, at 7 months when she's developed low back pain, and then 2 months postpartum.
Does she have any guys with
Nothing dramatic. Nothing dramatic. First time she's ever experienced back pain. If there are things that you need to be aware of as well during your treatment, I want you to note that as well, whether that might be something like vital signs or what have you, okay? That's part of your job as well. Anything that you think would go in the objective part of a note, you do it for these three, okay? And you get to see her, you only get to see her during these times. So a bunch of this is gonna need to be education.
We're just doing 3 different objectives for
3 different
one patient.
objectives, correct. Okay. This will be due upon my return, which will be next year sometime. July 10th at 9 o'clock. I hope y'all enjoy the heat and humidity, because I'll be in northern Michigan where the highs are in the 70s. Sunset last night was 9:47.
That's too late.
Oh, I'm excited about
I
that.
need it to be dark.
Nope. I'm gonna play golf at like 6 o'clock at night.
Y'all keep in mind with these, for like the abdominal impairments, it's not appropriate for them to do any abdominal strengthening if intra-abdominal pressure is not maintained properly. So if there's that coning there, you don't need to reinforce that. The coning, as in the diastasis recti, is poking out there. That's what they call coning. You can't have them do crunches to improve abdominal stability if there's that coning.
That's when you wear the bracing and all that stuff, and that's usually the postpartum stuff.
Is this electronic or earbuds?
Let's go electronic.
Can you handle it?
I will be okay with
Can
that.
you handle
Electronic, 9 a.m. Anybody have any 4th of July good fun plans?
Going to Louisiana.